Alright, so let's talk about reproductive health a bit. So, with the uterus, what can happen? Well, one thing, medical procedure involving the uterus, say a woman has uterine cancer or she wants to, absolutely doesn't want to have children anymore. So, what might she do? She might do a hysterectomy. So, again, this, especially with uterine cancers, yeah, you might have to do this as well. As you can see, there's different degrees of a hysterectomy. So, partial, you're keeping the cervix here, but you're removing most of the body of the uterus, whereas a partial, or actually a total here, you see that you're removing both the cervix and the entire uterus, but you're keeping the fallopian tubes and ovaries, because again, as you'll find out later, the ovaries are important endocrine glands. And in radical, what you have is also not only removing the entire cervix, you also remove the more interior part of the vagina. You do still keep the vagina, but it is getting rid of some of the vaginal canal. So sometimes this is done if a oncologist or a gynecologist wants to be really cautious about cervical cancer. But again, so hysterectomy. So hyster is a Greek root word meaning uterus. Now, this might sound like another word that you might be familiar with, and there's something called hysteria. And I put in quotation marks because hysteria, does it exist? And here's where, so hysterical. When something's hysterical, you think it's very funny, but again, this is one use of it. But another definition is like deriving from or affected by uncontrolled extreme emotion. We're talking about hysteria. So if someone's hysterical, then in terms of hysteria, you're thinking they're being very overly emotional, extra, and dramatic. But is this a real psychological phenomenon? Is this real psychological diagnosis? Well, hysteria is no longer recognized by the APA. The American Psychological Association does not recognize hysteria, but if you look at old psychology textbooks and old medical books, they talk about hysteria. And remember, is a Greek root word meaning uterus. So, which sex was associated with hysteria? So again, there's a reason why they chose this. They thought that it was exclusive to women, but again, hysteria just refers to uncontrolled emotions, and again, it's not even a real psychological term. But this is why. So the thing about medical and psychological, or medicine and psychology is that yeah, in history they had some pretty wacky ideas about the uterus and womb. So the ancient Greeks had the wandering womb theory, and this is probably what's one of the things that set off this whole concept of hysteria. So the wandering womb, they thought the uterus wasn't actually anchored via all these ligaments. So they thought the uterus could actually travel throughout the body of a woman, and they thought the symptoms of hysteria were being caused by the womb wrapping around the brain and causing all these emotions. And so does that actually happen? No, again, that uterus stays in place. You have all those ligaments. And fast forward in time to the Middle Ages, and they thought hysteria was caused by sexual deprivation. So as you can see, ancient people had some pretty crazy ideas about the uterus. So, and this is one way this is a treatment they thought that could prevent hysteria or treat hysteria. Yes, that is a fire, it looks like a fire hose squirting water and right onto this poor woman's external genitalia. So yeah, as you can see, they had some pretty crazy ideas back in the day. And what we have here, yes, his hand is up where you think it is, and it says like, here's Dr. Swift, a wonderful healer, through the magic power of his gentle massage. As you can see, not only did they have wacky ideas about the uterus and hysteria, they also had really wacky treatments on how to treat hysteria. And one of the ways they treated this is Dr. J. Mortimer Granville, and he's not only a doctor, he's also an inventor. And what did he invent? He invented this device. And you're going to be like, what the heck is this? Well, this is actually a crank here, and it does something to cause this to move around. And what does this move around? Well, he actually invented the first electric vibrator. And why did he invent this? Well, the thing is that this was what is the whole purpose of inventing this? Well, he was used to induce hysterical paroxysm. So when you have the term paroxysm, it's something that's a temporary state. So remember, hysteria back then was an overabundance of emotions. So he wanted to cause a big temporary swell of emotions. So yes, the way they thought you can cure hysteria back then is to induce an orgasm in females. The thing is that women were going to the gynecologist, and this is why that previous picture had that guy with his hand up his skirt, the skirt. He was actually trying to induce an orgasm to cure this supposed hysteria. So apparently, Dr. Grantville was so tired of doing this by hand, he actually invented something that he would save him a lot of time and effort by doing it with his own hands. But yeah, again, this is so it was invented as a medical device, not a recreational device.